Thank you, Homero, for the nice words. Thank you very much. I'm deeply honored. So thank you again for this award. I'm deeply, deeply honored. I have so much respect for APHA. I feel at home among you. It is my conviction that home, a sense of belonging, a place to exist, is a human right at the core of health and well-being. It is in fact the Greek word oikos, or home, which forms the prefix of both economy and ecology. However, in the disciplines of epidemiology, public health, and occupational health, we rarely use the term home. Instead, we speak of housing, of living conditions, or local contexts, of the built environment, of the physical environment, and of socio-political determinants. But none of these concepts truly capture the meaning of the word home. It is this concept, home, which I believe is critical to reflect on, especially in the context of migrant and refugee research. What is a refugee but a person who has lost their home? In 2016, the number of displaced people on the planet topped 65 million, the biggest number in history. And of the 16 million UNHCR registered refugees, almost 90% are hosted in overburdened developing nations. Lebanon, my home, is a case in point. A country of 4 million people and now hosting at least 1.2 million Syrian refugees, Lebanon has the highest concentration of refugees per capita of any country in the world. My research on migrant workers and child labor among Syrian refugees living in informal tented settlements in Lebanon has documented precarious working and living conditions, widespread food insecurity, poor sanitation, and other public health problems that exist in part because the Lebanese government lacks the capacity to support this influx and turns a blind eye sometimes. Our role as researchers cannot be limited to collecting information and producing science. We must also be advocates of the populations we study because we learn firsthand about their plight through documentation and research. When we document suffering in a population, we cannot stay silent about it. Engaging government, UN agencies, UN organizations, NGOs, lobbyists, and the media is a must, not a luxury. It proves to be difficult and challenging at times, but we cannot despair, and certainly cannot give up. I learned in my work that perseverance is key to overcoming obstacles and achieving goals. Thank you again for this award. I'd like to share it with all members of my research team back home, and I dedicate it to all the people who have allowed me to document their tough working lives and who have opened their homes and shared their stories with me. Thank you, and thank you, Celeste, who cannot be with here today. I also dedicate this award to her because she's been an inspiration. And thank you to all the Occupational Health and Safety Committee. Thank you, Homero, as well.